Hi guys. It's gonna be a short one because I am like in a lot of pain and it hurts to talk. I look so much better today, you have no idea. Um, I'll pop up a picture of what I look like the first day yesterday. But basically, I had to have a little bit more work than I expected to have done, which causes a lot more pain. We talked to the surgeon beforehand and he said that because it depends on the size of my mouth and how much bone decay there is and all that, how much more work he would have to do. And he said he might have to go up into the sinuses to get the bone graft and to bring it down and build a strong enough bone for me to have teeth. So we knew that going in, but I was just kind of like, I don't care, get it over with. I don't have a choice at this matter, so at this point, so just go ahead and get it over with. So that's what ended up happening. It was 5 hours with the surgeon, and he had to go up into the sinus cavity, hence the bruising up here, and he had to get the bone graft and use the bone up here in the sinus cavity to build the bone around the teeth. So that hurts. I am saying, I'm just like, out of all the 8 surgeries I've had with cancer, I would say this is probably the most painful. Hands down, most painful. Now, I don't know about long-term pain. We'll see. That should be pretty, the pain should heal fairly fast. Whereas when they took my stomach and kidney, that was like a year of severe pain. So, but for right now, immediately, this hurts like hell. So, yeah. So what happened was the first time we went in, it was 5 hours. Like I said, they did all the surgery, took the teeth, cleaned the bone, did the bone graft, and then packed me. I was like, ugh. And they wrapped ice around my head. They sent me back to the recovery room, which we had a private recovery room with my husband in there. So he was there able to stay beside me and take care of me the whole time, which was amazing. The nurses were just, the staff was just amazing. They were the best ever. I would highly recommend these people to you. They were great. So I don't remember recovery room very much, because I was still so I was kind of, under anesthesias, and I can't say that word right now. And then after that, they rolled me back in to do the teeth, and that part I remember. I was still like numb, but I was awake. So they could move my mouth around and tell me to bite and do all this, so they could get it in right. So they put the temporaries in. These are temporaries right here. These are not the ones that I get to keep. These are just placeholders so I can heal. So that part, and she screwed in the 4 screws, and then she put this mouth guard, I guess, inside your mouth. That's why I talk kind of funny. Anyway, so the bone can heal, everything can get in there solid, and then after that I'll have real teeth. That'll be 4 to 6 months. 4 to 6 months without chewing anything. Very important. So it's going to be a challenge to get some good stuff down. But I can do it. I've done it before. I mean, I had half my stomach taken out and no food and a feeding tube, so I can do this. This is not a problem. But that's where I'm at. I'm just going to heal. I'm going to take my Norco. And the only problem with being on pain medicine for so long, for those of you who unfortunately have had to, deal with narcotic pain relief, if you take it too much, it will not work when you need it again. And thankfully I've been very cautious with my medications in the past, so the Norco is working, but I was having some doubts that it would, but, you know, praise God that it is, because, you know, I don't want to be, I don't want to be any more pain than I have to be. But it only takes off, like, I would say, like 10% of the pain. The rest of it is just, it's there. There's just nothing we can do about it. So, yeah, we did have a issue when we arrived to the center. They sent us an email saying we should be there at 5:30 a.m. So, we arrived at 5:30 a.m. and I didn't sleep all the night before. I was nervous. And we got there and the gates were closed, and we called and they said, oh, you're not supposed to be here till 9:30 a.m. So we turned around, we went home, we waited, and then we went back again and got in there at 9:30 a.m. and everything was fine after that. But it was just a frustrating way I was already nervous and it didn't help things at all. So, yeah. Well, guys, I'm going to sign off because I am, like, in a lot of pain right now. I just wanted to let you guys know where things were at and what it looks like after having all your teeth pulled out, your upper teeth pulled out, and a bone graft, and the complications that can arise from having your teeth pulled out. And just to recap for the people who don't know, my name is Jody. I'm too cute for cancer. You can't tell it right now, for sure. But I'm living with stage 4 metastatic triple negative breast cancer that has spread to my bones. I was in a brief remission for 9 months, and recently I found out that I have a met on my sternum bone. But at the same time, I had all the chemo had rotted out the bones, and the radiation had rotted out all the bone in my teeth, and all my teeth were falling out, and they were rotting and everything. And they were beautiful too. They weren't ugly, gross things. And it happened very suddenly. It was just not expected at all. So I had to go in and have this surgery done. So that's kind of a brief catch-up. I'll put up a card and you guys can catch up with my journey. And if you'd like to follow my journey and support me, I would love it if you would hit that subscribe button. I know it doesn't look like I'm much right now, but I give you the truth. I give you the ins, the outs, the journey all the way from the inside out. I don't hide anything, as you can tell. I didn't wait till I looked better before I went on camera. In fact, I wanted to go on yesterday because it was the real deal, you know. But instead I opted for a picture just because I was just too out of it. But anyway, if you would like to follow my journey and support me, I would just so love it if you just smack that subscribe button and set that bell to notification so you don't miss anything good. I will be back with my regular video, probably a vlog, within the next week, like normal. I'm gonna keep going whether I look good or not. So, and I'll keep going with my healing journey, what I eat while I'm down. I think that'll probably be my next video. It sounds like a good one. So if anybody ever has to go through this, it would be a good timing, right? Sorry about that. Okay, you guys. Well, I hope you guys are having a great week. Thank you so much for all the prayers. I did read all of your messages. I read every one of them. I try to respond to everybody, but it just sometimes I can't. They slip through, and it's not because I don't love you all, but if you go back and read other people's questions and stuff, you might get your answers that way. So if I do miss you, then at least you have some kind of answer. Alright, but I do like connecting individually with each one of you. That's one of my goals. So, alright, you guys, I love you so much. Thank you so much for supporting me. And I will see you on the next episode of Too Cute for Cancer.